Hello YouTube and welcome to another installment of Listen Closely. This one is going to be going a little bit different than what I have been doing in the past. This video is going to be dedicated to health issues, specifically prostatitis. Now, if you don't know what prostatitis is, which if you're watching this video, I'm sure you probably do know what it is, it's usually a bacterial infection of the prostate. A little bit of background information on me is I was diagnosed with acute bacterial prostatitis back in late 2009. It sucked. It was, to this day, I think that prostatitis is one of the most uncomfortable, most painful things I've ever experienced in my 33 years of life. The first time I had it, I had to go on an antibiotic called Bactrim, and that took care of the prostatitis the first time around. And I was in pain for probably 2.5 years after I cured the bacterial infection from my prostate. And I always thought it was my prostate that was hurting. I was going for constant checkups. And whenever I would go for a checkup, the doctor would check my prostate, and afterwards I would feel good. But then after about a month or so, the pain would come back, and this would go on and off for about 2.5 years, as I said. And afterwards, it cleared up, and I got it again for a second time in 2015. Wasn't as bad that time around. The first time in 2009 was a heck of a lot worse. And in 2015, I went on Cipro for that specific infection. And then I got it again earlier this year in April, actually around Easter of this year. I had it a third time, and the third time was better than the other two times. So I'm hoping that means it's working itself out. But in any case, as I said, I was diagnosed in 2009 with acute bacterial. Because it kept coming back, it now changed from acute bacterial prostatitis to chronic bacterial prostatitis because it's reoccurrent. So, usually with prostatitis, I had all the hallmark symptoms. I had blood in my semen. I had pain in the perianal area, pain in the anus, pain in the penis. To, sum it all up. And it's a very debilitating issue. I feel sorry for anybody who has it. And, I want to give some information to help you cope with prostatitis, because I have found out in the 3 times I've had it, I've found out if you're anything like me, where you get a flare-up of prostatitis, you take the antibiotic, you cure it, but then you're still in pain for months, even maybe years afterwards, you're probably in pain because you have what doctors like to call chronic pelvic pain, which is problems in the pelvic region. Now, that is all true, and I guess I should get into, for those of you, now since I gave my background on prostatitis, what causes it. Well, what I found out is that prostatitis, people who get it, usually have a genetic weakness in their prostate that makes them susceptible to a bacterial infection moving in. I did find out that I have, on my mom's side of the family, both her brothers have had prostatitis, so it runs in my family. I've got it when I took an antibiotic for H. pylori bacteria. It was a very strong antibiotic, and about a week or so after I took the antibiotic, I all of a sudden came down with my first bout. Usually, you will have to find an antibiotic that works good for you. Usually, the fluoroquinolone, for me anyway, the fluoroquinolone antibiotics work well, but not Cipro. Cipro I had problems with. It gave me a candida infection, so I have to take Levaquin. Levaquin was what I took the last time, and it worked fairly well for me. What I do want to stress is, after you take an antibiotic, if you're someone like me who is in constant pain, if you're having pain after ejaculation, pain during sex, any of that, yes, that's prostatitis, but that can also be chronic pelvic pain. So what I want to say is this: most times, 9 times out of 10, if you have a bacterial infection of the prostate and you take Cipro or Levaquin, or even Bactrim, I heard doxycycline works well too, but if you take one of those antibiotics, you've pretty much cured the bacterial infection from your prostate. But what I didn't know is that whenever you get prostatitis, it traumatizes the pelvic region. It causes all the muscles in the pelvic floor to tighten. And so whenever you have sex and you ejaculate, of course, when you have an orgasm, all the muscles contract. And if you have all this trauma in the pelvic floor, it's going to cause you pain. So in 2015, I went to the doctor thinking that my prostatitis was back after already taking antibiotics, and my doctor wasn't available. So I saw the RMA, and this RMA used to be a pelvic floor physical therapist. She checked my prostate, said the prostate was fine, but she noticed the muscles in my anus were very tight. And she pushed on some of them and said, "Does that hurt?" And sure enough, it did. So she said, "You need a pelvic floor physical therapist." So she gave me a referral. I went to a pelvic floor physical therapist, and sure enough, this woman came in. She knew a lot about pelvic floor dysfunction. She knew a lot about prostatitis. And she gave me a series of stretches to do. Now, unfortunately, I can't show them because I can't move my webcam, but she gave me a series of stretches, and you don't really feel any stretching in your pelvic region. It's more like upper thigh stretching, and those are the muscles you feel getting stretched. But after a couple of weeks of doing them nonstop, you start to feel better. And on top of that, what the pelvic floor physical therapists also do is something called pressure point physical therapy, which is where they put a rubber glove on, put the finger in your anus, and they push on the muscle walls. It's painful, but it causes the muscles to release, and you're getting rid of that tension. And when you get rid of that tension, you start to go back to normal. The pain starts to subside. So one way you can test it on yourself if you're feeling, daring, is if you have a latex glove, put it on, put your finger in your anus about up to the first knuckle, and just push around on the muscle walls. If they feel uncomfortable or kind of painful, that's what's causing your discomfort. And if you want that to go away, you can maybe wait it out and suffer with it, or go to your doctor, tell your doctor you want to see a pelvic floor physical therapist, and go. They'll give you some exercises to do. They'll do some pressure point PT on you, and after a few months, you do feel a hell of a lot better. Now, I haven't, I went earlier over the summer to see a physical therapist, and I'm still having a little discomfort, but I'm doing the stretches, and the stretches have helped immensely. I would say, I only have 15% pain, which is where, contrary to what I should have had, in my position right now. But the stretches and the PT really do help. And I just want to say, you might be saying to yourself, well, how could muscles in my anus be causing me all this pain? Well, you'd be surprised. In 2015, after having prostatitis, I had pain in the tip of my penis for months. And after every session where the physical therapist would do pressure point PT on, my anal walls, when I would walk out of that place, the pain in the tip of my penis would be gone. It would come back slowly, but you got relief out of it. So, not too many people know that. At least I don't think too many people know that. And I think it's very important that, I wanted to get that out there, because prostatitis sucks. If you're watching this, and I feel bad for you. If I'm suffering through it just like you guys are. It sucks. It's terrible. I feel bad for you. But, there's several things you need to do when you have prostatitis. Find a good antibiotic that works for you. The fluoroquinolone drugs are nasty antibiotics, but they work very well in the prostate. Drink plenty of water. Lots and lots and lots of water so you can flush that area out. Excuse me. When it comes to sex, make sure you're having sex or masturbation twice a week. No more, no less. You need to be doing that because you need to flush out the prostate. You got to flush out the dead bacteria, and you got to flush out the antibiotic because that can cause irritation in the prostate as well. And the last thing, get yourself to a good physical therapist. If you've already taken the antibiotics and you've been months now with pain, you got to go and see someone. See a physical therapist. You could be cutting this short. You're in pain right now, see your doctor. Demand that you want a script to see a physical therapist and go see one. You're going to feel better, I promise. Yeah, I mean, it's not great when somebody has to stick their finger up your ass, but if you but if you know it's going to help you, why would you not do it? Don't let pride get in the way. So that's the biggest thing I can recommend is PT solves a hell of a lot when it comes to prostatitis. You want to take care of that because I know it impacts your life, it impacts your relationship life, your sex life, you name it. It's just a huge drag on your love life, and it's a drag on your life in general because it's a painful thing to go through. So, in addition, I forgot too, in addition to those four things, a fifth thing, make sure you're taking sit baths. Sit baths are really important as well because that heat relaxes those anal muscles. So that's the biggest thing. For anybody who doesn't, know too much on prostatitis or doesn't know why they're suffering with chronic pelvic pain, I'm telling you right now, if you took the antibiotic for your prostatitis, the bacteria is gone. Your prostate's now fine. It's your pelvic floor muscles that are causing you all this distress. Pain in the penis and everything. It's all coming from the pelvic floor muscles, specifically in the anus. So if you can get yourself to a physical therapist, I will be happy if anybody wants to know some of the exercises. I still have the papers that show what exercises you need to do. I don't have all of them, but I can dig them out. If anybody wants me to send them to you via email, I will be happy to share what I have. And these exercises came straight from St. Peter's Hospital Physical Therapy Group in Albany, New York. Um, you know, take care of yourself. Another thing that can be helpful too is be on a good prostate supplement. I don't take too many prostate supplements because they're strong and I have issues with my gut. But, I would say actually that's the sixth thing that you want to do. So, you want to find a good antibiotic. You want to drink plenty of water, sex only a couple of times a week, get to a physical therapist, take sit baths, and then find yourself a good prostate supplement to build up because you do have a genetic weakness in that area. That's what's allowing the bacteria to keep moving back in. So you want to take care of that. So build yourself up with a good natural supplement and just take care of yourself. Another couple of things which I want to point out, these are two things that irritate the prostate. Alcohol, which I'm sure you probably figured that out, irritates the prostate. Caffeine can irritate the prostate. Another thing that irritates the prostate is not getting enough sleep. So make sure you're getting 7 to 8 hours or more a day because if you don't, that can cause more prostate pain. Also, make sure you're eating. If you're hungry, I've noticed when you're hungry, that causes prostate pain. So keep food in you. That reduces the pain as well. That's pretty much everything. And, again, my heart goes out to anyone suffering with this terrible illness. It does get better for anyone who's demoralized with it. it does get better. I mean, if you choose not to go the physical therapy route, it does go away on its own eventually, but you know, it does get better. Um, you may get it back again. May go a few years before you get another episode if you're chronic bacterial prostatitis like me. But you know, the point is that it does. After you take the antibiotics, you may have to wait a while. You may have to wait like a year, but you know, it does go away. And you know, you can probably, you know, I know people who are married and have girlfriends and stuff who have this problem and they still have a normal sex life, you know, even though they have to slow it down a bit, still eventually gets to the point where it clears up, you're not in pain anymore, and you can go back to having a normal sex life. So don't let this get you down. It gets better. Keep a good frame of mind. Thinking positive affects everything. You know, if you think negative, it's going to cause more pain in the prostate region. It actually causes pain all throughout the body. You know, as somebody who also has IBS, it hits your gut as well. So you want to keep your mood elevated, and whenever you feel depressed over you know, the prostate or the pain that you're experiencing, just keep saying to yourself, it goes away. You know, you'll be back to normal one day, and you will. I've gone through it 3 times. This is my 3rd time right now. I'm still kind of shaking off the symptoms, but been through it twice before, and both times it goes away. You go 100% back to normal, and you know, I'll go back to normal too after this, and so will you. So take my advice, do those things, get yourself to a physical therapist. Cut the pain short if you can, and you'll feel better. And again, if you have any questions on prostatitis, any specific questions that I didn't cover in this video, for the love of God, please ask me so I can help you out. Because I really do want to help anybody who has questions and needs answers. You know, about this, I'm more than willing to help. I'm more than willing to answer. So I can't emphasize that enough, though. Get yourself, if you've taken the antibiotics and you know the doctors are telling you your prostate's good, get a script to go to a physical therapist for the pelvic floor. You'll feel so much better. I'm telling you, all your problems are coming from the muscle regions in your anus. Learn the exercises, let them do pressure point release if they need to, and you'll be better. All right, until next time.